The pandemic is raising the most fundamental moral questions about life and death. New York's healthcare system is overwhelmed. We're running out of hospital beds and life-saving equipment. There's now the prospect of medical rationing. Joining us now is John Brehaney, an ethicist with the National Catholic Bioethics Center. And John, a huge issue facing doctors and nurses. They don't have enough ventilators for all the patients who need them. This is a moral issue as much as a medical one, deciding who gets treated and who doesn't. What are the ethical considerations?
Yeah, in times of panic or even pandemic, I think we have to step back and root ourselves in our most basic responsibilities and duties. And in the ethical life, we always want to avoid causing or intending harm, and as much as possible to protect and promote human goods like life and dignity and health. So now when you come to this issue of ventilators, I think what people are struggling with now, I think they're working through the issues. How do we avoid basing decisions on anything irrelevant or bias, like age or disability or race or anything? And the good that they're trying to do is to say, how can we steer patients to the right levels of care, get the patients in the most need to the levels of care that are going to do them the most good. So they're working through that right now, and we're helping some of them.
Oh, that's good to hear. The Emergency Medical Services Council of New York is issuing guidance to EMS first responders that if a cardiac arrest victim's heart can't be restarted, don't bring that person to the hospital. Instead, the patient will be left to die. What's your view of this decision?
I would say one thing that this pandemic is doing is it is upsetting business as usual. It's upsetting the customary way we do things. In fact, it's upsetting even some of the good things we do on a daily basis. This is very unfortunate, but I think people are being called to make hard choices, and I think they're trying to make them well. In other words, what they're saying is, those patients in cardiac arrest may be brought into an ER, which is full of patients with severe respiratory conditions from COVID-19, and one of the worst comorbidities you can have, one of the worst health conditions to get the disease with is cardiac disease.
Right. And the Catholic Church, as you know, values every human life and is strongly opposed to things like euthanasia and assisted suicide. How should we as a church behave during this terrible crisis, and could lines get a little blurred?
Well, they can get blurred. I think in general, this is really a time to pray. I mean, to pray to God for all the patients out there, the people suffering, the healthcare workers, and so on. It really is time to pray. I think it's also a time to step out and act and volunteer, maybe in a way we never think to in our daily lives. We run around and we're all trying to cover a number of bases. But in particular, to think of healthcare institutions or workers and what we can do to provide them, again, with prayer support, with some sort of emotional or other form of comfort support, and maybe even volunteer in ways with deliveries or something that would make their lives easier to bear right now.
Yeah, coronavirus is really tough on our medical professionals, all the doctors and nurses out there, everybody else. They're being put into roles they never expected, deciding who lives or who dies. What moral guidelines should they rely on?
Well, I think the church certainly upholds the notion that humans have the ability to make good ethical decisions. We need the help of grace to do those well. But people need to exercise the virtues, like prudence is a virtue that perfects our decision-making capability, and fortitude. So again, I think as they make these decisions, they have to avoid bad reasons for making them. Fear, the way we've always done things, even fear of lawsuits, and say, let's focus on the most essential things. What is going to protect human life, human health, and to do their best with the limited resources that they have.
All right, John Brehaney, an ethicist with the National Catholic Bioethics Center. Thank you for joining us.
My pleasure.
If you're watching Currents News on YouTube, be sure to hit the subscribe button and then click on the bell to get instant updates about all of our newest content, because we are putting your faith in the news.